Hi, good morning, friends. We were discussing about the arsha, that is piles, or any other rectal conditions which are fleshy growths. It may be given up to the severe conditions like the carcinomatous conditions of the anus and the rectum. And coming to the clinical diagnosis of piles, usually already you know that the piles, as per the modern what you call the clinical diagnosis, the four stages have been mentioned. That is especially with reference to the internal piles. So internal piles, when it is not prolapsing out, when it is not protruding out, it is called as first degree piles. And when it starts protruding out during the defecation and it recedes back on its own into the anal canal, then it will be almost second degree piles. And when it comes out during the defecation and it doesn't go on its own inside the anal canal, then patient usually pushes it down into the anus, and that is the third degree piles. And fourth degree is when patient not able to manually replace it into the anal canal. Okay, well, then it remains outside even after the defecation. So this is usually the internal piles classification is there, and at the same time there is another piles, that is external piles, which are outside, that is covered with the skin, and the internal piles are always covered with the mucus. And the third one is there internal external pile masses, where the certain portion of the piles will be covered with mucus, as well as the uh, other part will be covered with the skin. So that is the intermediate, and it is residing both inside and outside. And coming to the Ayurvedic classification, Arsha is classified as Vataja, Pittaja, Kaphaja, Sannipataja, and Sahaja. Already you know that. And Vataja, now the usually it is easy to diagnose, or it is easy to make an authoritative clinical what you call the finding or the diagnosis as per the piles or external piles as well as internal piles, what I discussed now. But when it comes to the making the Ayurvedic diagnosis, so Vatajarsha, whatever the classification, the clinical features have been given by the classics, is they are very hard to touch. They have got rough surface and they have got irregular shape, and they are not bleeding. So most, and even the same is the Kapha and Kaphaja Arsha are bigger in size, but they are smooth surfaced, and again they are not bleeding. So as per my clinical experience, the purely external piles can be attributed to the Vataja Arsha, and Kafaja Arsha, it can be external as well as the internal, because based on the color change, even I noticed that the third degree piles, okay, when there is a bleeding is reduced because of the fibrous coat, a white fibrous coat on the mucosal surface. Most of the time it presents with that Pandu Varna, Shweta Varna, as well as their non-bleeding. So that can be considered Kafaja Arsha along with the external piles where there is no much dark discoloration. And Pitta Arsha, of course, is purely internal pile mass, because it has got that bleeding tendency. Even the same with the Rakta Jarsha, with the more severe bleeding, what you call the tendency, as well as what you call the red discoloration, more congestion as rather. And Sanipata is a mix of this, so it can be internal external pile mass you can consider for Sanipata Jarsha. And Sahajarsha, of course, from the birth. There is no, I believe that it will be difficult to understand. And why this particular understanding is important is because based on this we are supposed to plan our what you call the treatment. And of course Vatajarsha, the indication other than the Beshija is of course for depending upon the doshic variation you will be deciding. But when it comes to the other three modalities of the Arsha Chikitsa, that is Shastra, Kshara and Agni. So Pittaja and Raktajasha can be treated well with the Kshara as well as the Shastra, whereas Vataja and Kafajarsha can be treated with Shastra Karma or Agni Karma as per the requirement. So that was the thing I wanted to share today, and I hope this will give you some insight. And stay tuned for my next video about the treatment modalities, means the detailed treatment, and the ready prescription for the files. And I hope this will help you to build your patient in traffic, and you will be in a better position to give better result for your patients of the anorectal problems. Have a good day, and thank you for watching this video.